The RAPID study was to assess the effectiveness and safety of the antibiotic envelope. In order to answer this question, we conducted the study. This was a global study that we enrolled close to 7,000 patients across the globe, 181 centers in 25 countries. And those patients were randomized in one-to-one fashion. One group got the envelope at the time of the procedure, the other group did not get the envelope, and that's our control group. And we followed this group of patients throughout 12 months of follow-up at a minimum, and the primary endpoint was major device infection over a course of 12 months in both groups, the envelope group and the control group, and then we made the comparison. And we also assessed as a secondary endpoint the safety. Did complications happen more in one group versus the other? And when we did the study and we followed these patients up, the primary endpoint showed that the envelope was effective. It led to a significant 40% relative risk reduction in the risk of major CID infection over 12 months of follow-up without increasing any complications. The complication rate in both groups were very similar, and the envelope use did not lead to any increase in complications. So we have a therapy that has proven to be effective, and at the same time it's safe. Now, what we learned in RAPID also, in general, the infection rate was lower than we expected. So in the control group, the risk of infection, major infection over the course of 12 months was 1.2% in the control group versus 0.7% in the envelope group. And that is, for us as an electrophysiology community, that is a good news. This is coming in a time when people were concerned about the rate of new infected device outpacing the rate of newly implanted devices and whether infection is getting out of control. What we learned from RAPID that infection rate is on the lower side, it's 1.2% the control group, and to be able to start with a low infection rate and drop it even significantly lower to 0.7 with 40% relative risk reduction was remarkable without increasing any complications. Sure. So, RAPID is one of the largest studies conducted in the field of electrophysiology. Our studies in our field, the 7,000 is a very large number. It's truly a global study. We tried our best to be as inclusive as possible. So we want this to be global. So it was conducted in 25 countries across the world. We limited the enrollment in each center to 100 patients because we want everybody to participate and not to be exclusive to certain tertiary care with high volume centers. And we're going to learn a lot from RAPID. There's a lot of questions in the field of device infections that are still not answered. Let's start with the true rate of device infection in a large cohort they were followed prospectively over a course of 12 months with very clear definition of what major device infection is, with a clear denominator of the whole cohort, and we had an adjudication committee that reviewed all these adverse events, and it consisted of both electrophysiologists and infectious disease who are expert in the field in adjudicating all the adverse events. We're going to learn more about the risk factors, hopefully, for infection, and there's a lot of forthcoming data involving the cost effectiveness of using the envelope and minimizing the risk of infection, and that hopefully will be coming in the near future.